long introduction. Well,
Technical difficulties.
that works. All right, so who is PharmaCann? So PharmaCann, we were founded in 2014. It was Teddy Scott and his partner that founded our organization, and when I was making my transition into the cannabis industry, I was very selective with who I wanted to work for. Right? What really drew me to PharmaCann was that the company was created out of compassion. One of our founders had somebody that was suffering, that they did what they had to do because there weren't cannabis regulations, and that's something that we don't want to happen. Right? I mean, I don't know if you've heard the stories, families that uproot and they go to different states, because they're getting stuff illegally, and it's just a mess. Right? So the fact that there's a legal option out there is pretty amazing. The fact that our company was started out of compassion was the reason why I joined. So we operate, you see some pictures there. That's one of our facilities in Hamptonburg, New York. It's a 150,000 square foot, 125,000 square foot grow facility, which is unlike anything that I've ever seen. And really our goal is to offer safe, effective, quality, tested products to patients so that they can get better with the conditions that they're looking to treat. All right, so as far as our footprint, we're in a couple different places. We're in Illinois, we're in New York, we're in Massachusetts, we're soon to be in Ohio and Pennsylvania, soon to open up. The plan is to be open and operational by the end of the year here in Virginia. But the track record, obviously impressive, the states that we've worked in and the things that we've gotten up and going. But what's even more important about this is that cannabis federally, right, it's still a Schedule I substance. Each state has different regulations that they have with their cannabis programs. So the interesting thing is that when we operate, we get the experience with different regulations, right? So the way that we do it in Illinois is different than the way that we do it in New York. It's different than the way that we're going to be doing it in Virginia and Ohio. But the cool thing about being vertically integrated and being a bigger corporation is that in each state we identify best practices. Right? And then when we go to a new state, even if the regulations don't require that, if we identify a best practice from another state that we're in, we're going to implement that. Because at the end of the day, our biggest thing is that we want to be safe, we want to have quality products, and we want to have a secure facility. And if that involves, learning something from a different state and bringing that to a new state, even though we don't need to do that, that's something that we do. Perfect example in Hamptonburg. So and I joke about this when I tour people through there. Hamptonburg is our grow facility in New York.
The mic is on if you want to stand for the podium.
Should be on that podium.
Yep.
Hello? Yay, success. All right, so Hamptonburg, that's our facility that I was referencing back in New York. So we have what's called a vault. So basically a vault is where cannabis is stored, final finished product cannabis. At a processing and cultivation center, you have big vaults. At dispensaries, you have vaults that are a little bit smaller. But it's interesting because when I tour people through there, I'm not kidding you, this door is about probably 8 to 10 inches thick. And it's funny because somebody that is trying to get through that door, even with the appropriate tools, it would take them 45 minutes. So that's the type of security that we have, and those are the best practices that we bring from all the states that we operate. And I'm going to say this many times throughout today, super excited to be bringing it to you and the patients here in Virginia. So thank you for having me. All right, so it gets a little confusing, which is why we have the diagram of what to expect from us out here. So we have PharmaCann. So PharmaCann is our corporate office. Right, that's based out of Chicago. That's the administration side of things. Underneath, you have VeriLife Retail, and then you have PharmaCann Cultivation and Processing. So when you're talking about our cultivation and processing center, we refer to that as PharmaCann. When you talk about our dispensary or medication providing side of things, that's where you're going to see VeriLife. So, and this gets totally confusing, which I think, this is great that, I had the team put this together. So when a patient goes to our location in Staunton, they're going to go to VeriLife, right? Now at VeriLife, we're going to be producing our own products, safe, high quality, tested, and what those are going to be called is matter. right? So you see the Matter brand that we have up there. So PharmaCann, the parent company, Verilife, the dispensing agency. PharmaCann is also the cultivation and processing side. The products that we produce are Matter. And then also, I know that, I don't know if this is something in the regulations right now. I know that, this might be something to come about later, but carrying third-party products. So, over the course of the last year, I've been very fortunate to have conversations with not just PharmaCann, not just the people that support us, but the other registered organizations out here, right? And that's what it takes to get the Commonwealth together, right? All of us are working together. So I'm not speaking for the other registered organizations, but having a unified voice, having a unified plan is going to get better results for patients. It's going to get better products for patients. And eventually one day we would like to see where, you could come to a Verilife dispensary and you could get Matter products and maybe some of the other products that the registered organizations are producing. The good thing about that is that, one person can only do so much. Right? So if we are working together with the other organizations and we have these conversations, hey, we're making this one-to-one product. Maybe let's make a lot of that and then supply that to you, whereas if you make a 2-to-1 product, you make a lot of that, supply it to us, and who benefits from that? The patients at the end of the day. Right? So the more variety as far as different ratios, and we'll get into this a little bit later as far as ratios, THC and CBD, but that's a little bit, what to expect. So, when patients are actually coming to our dispensary, Verilife is going to be the name that they're going to see. So where does Verilife come from? So Verilife, Vera is Latin for truth, and life, that's what we do every day is we give people their lives back, right? So it's interesting because over the course of the last 2 years, going to different industry events and going to different trade shows, it's funny to walk a trade show floor and to go to 10 different packagers and hear that they have the best packaging out there. Right? All 10 of them will say, we have the best packaging. Right? Same thing with lighting. Right? You walk across to all the different booths with the lighting, oh, we have the best lighting out there. If everybody has the best, does anybody really have the best? Right? So that's one of the core values of our company is transparency, truth. Cannabis isn't for everybody. There are certain people that are at the end of their rope that can benefit from this, right? So that's one thing that, here today and then leaving here today, I could guarantee you is that we want to work with you, right? We're new to Virginia as well, right? So we want to be partners with you, the community, to really make this program a success and to really help patients that are suffering. And there's no BS in our eyes, right? We're transparent about everything that we do, and that's, something that we bring to every different location that we go to in every different state, right? Because at the end of the day, this is about the patients. And then life. So, like I had talked about earlier, we give people their lives back every single day. And that's, why we came up with the concept of Verilife for our dispensary side. All right, so when I think about our dispensaries, there's 2 different components. There's what happens outside the 4 walls, and then there's what happens inside the 4 walls. So what happens outside the 4 walls are things like you see out here. These are core values. These are things that are very important to our organization. This is my responsibility when we get things up in Virginia to make sure that everybody is aware of these different services and that everybody can take advantage of these different services if this is something that could benefit you or people that you know. So a call center, right? So over in Schaumburg, Illinois, we have one centralized location that's taking calls for all of our dispensaries. So the reason why we did that is because when we would get a dispensary up and running, they would be servicing patients, and the busier that they would get, the phone would ring, and sometimes somebody would be with a patient, helping a patient. So, somebody would have a little bit more questions, and we didn't want to neglect that patient in front of us to answer the phone. So what we did is we put together a call center, a place that you can call day or night where you can actually talk to a live person. Is that even possible nowadays, that you call some place and you could talk to a live person? But that's something that we have available for patients, for doctors, for physicians, for anybody to call the call center for any questions that they would have. Another thing, so pre-order for pickup. So like what we see with patients is that there's some patients that want to come in and maybe they're a new patient. right? So they need to be sitting with one of our patient care representatives for 30 minutes, 45 minutes, whatever it takes to get them comfortable with the medication. But what I've learned is that over time, as you educate the patient, as they start minimizing the symptoms that they initially had, as they start getting their lives back, then it's just more of a, okay, I need a refill on my medication. And what we noticed is that we had to accommodate both types, right? We didn't want to go one route or the other, so that's where we have, rapid pickup for patients that are educated about the process. Application assistance, so that's one of the coolest things that, I help with each of the states get up and running is application assistance for the patients. I know out here that it's going to take, going to a physician and then submitting an application where you have, residency verification, potentially a driver's license. And that could be a hard process, especially if somebody is sick and suffering. And you have to be a lot of the times a little bit tech savvy to upload these things and resize them and things like that. So that's one thing that we're going to be adamant about helping patients with is the application process, helping you get through that, with the state. And then most importantly, physician outreach, physician and patient outreach. We have dedicated people 24/7 in the community that go out and they talk to doctors, they talk to patients, and they educate them about the program, and they answer whatever questions they have about the program because there will be questions. And I know that a lot of you have them today. All right, so that's what happens outside the four walls. Now, inside the four walls, 3 different pillars, so to say. So the first one is customer service. Has anybody ever been to a dispensary before? So for those that haven't, there's a lot of misconceptions that a lot of the times they think about. A lot of the things that we see in the media from the West Coast, how they do things out there, they think that that's what you'll find in one of the, the medical cannabis dispensaries that we see. But really in the dispensary, there's a couple different things that are going to happen. When a patient comes in, we do an intake procedure, right? So we're going to ask them what their goals are, what their lifestyle is like, and also what their budget is, right? Because cannabis, it's not covered by insurance a lot of the times. A lot of the times that's going to be out of pocket. So, and we understand that, finances are tight, especially if somebody's on, SSDI or if they're a veteran or things like that. So we really want to work with them to figure out, okay, what's going to be the most appropriate cannabis regimen, but yet let's fit it into your lifestyle, let's fit it into your budget. So education for impact, I think, not to use the cliche analogy, but you can catch somebody a fish and give it to them, or you could teach them to fish, right? Right. So that's what we do, is we teach people to fish, right? So initially, there's a lot to learn. Okay, what's the difference between THC? What's the difference between CBD? This product came from this different strain category. It's a lot, and it can be confusing. So really, and what's different between what I've seen in medical cannabis from my healthcare career is that it's a 50-50 approach with the patients. Right, so back in the day when I had this medical center with doctors, commonly what we would do is we would tell people what to do. We would say, you take 10 milligrams TID for 3 times a day for the next 30 days and then come back and see me. Where that's not the same with medical cannabis. It's a proactive approach, which is what I love about the industry. We actually require patient engagement. Right? So when you first start a regimen, yes, we have recommended doses. You always want to start low and you go slow, but I like to call it the 30-day titration phase. So for the first 30 days that somebody starts a regimen, it's going to be figuring out, okay, do I need to increase the amount of THC? Do I need to decrease the amount of CBD? What is the ratio of these two things? And it's not an overnight process. So that's where working with our patient care reps, working in conjunction with our dispensaries, having our call center to reach out to is imperative until we get that initial foundation of education, and then people start getting results and start minimizing their symptoms. And our goal is to teach you to fish so that you get to the point where you come to our dispensary, you get a refill because you know exactly what you need for that day. You know exactly what you need for that time. And then patient advocacy. So access to the program is something that could sometimes be hard in different states. I remember in Illinois there was one thing where they did a fingerprint background check for people before they could get access to the program. So really, through patient advocacy, through working in the community, through working with different organizations, our goal is to make it as easy as possible for people to access this medication if they're applicable for it, if they qualify for it. All right, security and safeguards. So for those of you that haven't been to a cannabis dispensary, cultivation, processing center, I mean, it's like Fort Knox. I mean, I remember, with some of our processing centers, before they got to know me, I mean, they would meet me at my car literally. And what I mean by that is that they're watching those cameras intently 24/7. They see somebody that pulls up in a rental car that they don't know who this is, and they're meeting me out at my car. It's like, oh, hey guys. Now they started to learn who I am, so we don't have that. But many different safeguards that we have in place to make sure that our facility is extremely secure, right? That there isn't going to be any risks with things that we're doing. And an example that I like to use is, if we were all in this room today and we were concerned about the ceiling falling on us, how good of a conversation would this be? Right? Some of us would be looking up. I'd probably be looking up too. So we don't have time for that. We need to put processes in place. We need to take best practices from different states that we have so that we could focus on the patient, right? And we have pretty good things that we have going as far as 24-hour continuous surveillance and alarm monitoring, right? So our IT team, I mean, they have over 1,000 different cameras in multiple states that they're monitoring, saving that data footage. Each state has a different regulation, whether you need to keep it a couple years, whether it's 7 months. So I mean, we have terabytes of data that have things on it from just all these cameras that we have in each of the dispensaries, which is important. If anything does happen, we need to have that footage. Now also a lot of the times we give remote access to the local municipalities and the police departments so that there's that second set of eyes to help us if anything does come about. And then, as far as in the buildings, I mean, that's the main thing. Even on the dispensary side of things, when you walk in, you have to have a medical cannabis card and you have to have your ID. A lot of the times, there's a waiting area that people will sit in, and then you get back to a dispensing area. Even back at that dispensing area, they ask for the same thing. Can I see your ID? Can I see your medical card? So not only do you have to have access through the regulatory process here in Virginia, but we put safeguards, not just one, but two, so that people make sure that they're in the facility and they should be in the facility. I have to commend my team. I mean, it's amazing to see the steps that we've taken and the minimization of risk that I've seen because of all these processes that we put in place from the security and the safety side. All right, so as far as just being a registered organization here in Virginia, there's a limit as far as the possession that patients could have. I know, Andrew, we were saying 30 days, right, is something that we were talking about, a 30-day limit? Is what? 90 day? 90-day limit. There's also different systems for tracking, right? So, in each state, they have a centralized system where they track each and every purchase. I know that here in Virginia, we have a pharmacist on site. A lot of the times, too, these tracking systems also integrate with prescription management programs or PMP systems. I'm assuming that's something that's going to be in Virginia, too, because we're working with the Board of Pharmacy. And seed to sale. So with this tracking software, we are able to say exactly where a plant is all the way from seed into harvest, into extraction, into distillation, into final finished product, and into packaging. Right? Throughout that process, at any given time, with a couple clicks from my IT team, I could tell you, okay, this seed that started here, this is where the clone is from that seed. Okay, this is where we harvested some products. So I mean, it's pretty sophisticated, the tracking that goes into place and the regulations that go into place for safety and security with the medical cannabis program. This is my favorite part of the presentation, cannabis basics. All right, so cannabis has been around for thousands of years, right? So, it's been used for food, it's been used for fuel, it's been used for textiles, more importantly, it's been utilized for medication, right? So it was back in the late 1800s that was actually in our US pharmacopoeia, cannabis, right? So back in the day, you were able to go to a pharmacy, the same way like a CVS or a Walgreens or one of these places, and you would get a tincture or an oil that's infused with the cannabis products, and you would go the same way that you would get prednisone or you would get penicillin or any of the other medications. So what happened? Right? So in the early 1920s, big propaganda campaign that was put together, Reefer Madness. Is anybody familiar? Has anybody heard? So I hear some chuckles, but it's interesting because, nowadays, I mean, it's pretty crazy how that movie, portrayed cannabis, but at the same time, putting yourself back in that time frame and seeing something like that, I would have those same stigmas too, right? I mean, it did its job of creating this perception that, cannabis has no medicinal benefit. It's the gateway drug. I mean, that started back in the 1920s. Now, fast forward a little bit, it was actually removed out of our pharmacopoeia back in 1938 with the Marijuana Tax Act. So basically they said that, physicians, they could still prescribe, they could still, for marijuana, but there was a tax that they had to pay. And back in the day, it was $1, which was a lot of money. So what happened was it ended up, being removed from our pharmacopoeia and being removed as medicine. Fast forward now to the 1990s, right? So 1996 is when California first had its first, was our first medical state. Now, during that time frame, as in the US, we had this propaganda campaign. We were talking about the negative benefits of cannabis. Overseas in Israel, they were doing the exact opposite. So has anybody heard of Dr. Raphael Mechoulam? Right, so Dr. Mechoulam was the first man that discovered THC, delta-9 tetrahydrocannabinol. So basically, he was just excited about the fact that, okay, we see that somebody utilizes this medication and they have an effect from it, but we don't know why. We have no word for it. We don't understand it. So he was the first one that discovered THC. Soon after that, he discovered CBD, or cannabidiol, right? So they were doing research on the benefits of cannabis, the safety profile of cannabis, and then what happened was in the early 90s, they discovered something called the endocannabinoid system. Has anybody heard of that term before? So basically the endocannabinoid system is a system of receptors that work in conjunction with cannabis to help modulate different responses in the body to help establish homeostasis, balance. Right? So when the body is out of balance, a lot of the times we have anxiety, we have pain, we have nausea, we have different symptoms that we deal with. So really the role of cannabis is to work with this endocannabinoid system to help modulate these responses. Now what's even more interesting is that they discovered that we also produce what's called endocannabinoids. Right? So endocannabinoids, so everybody in this room right now has an endocannabinoid system and it's working in conjunction with your endocannabinoids. Right? So, everybody feel that? No, just kidding. But really, you have compounds in your body that interact with this endocannabinoid system the same way that THC does. Right? It's called anandamide. So when that happened, I believe, in my opinion, that was the catalyst because that was around the early 90s that really started changing people's thought process on cannabis. Is this really the gateway drug? Is this really something that doesn't have medicinal benefit? I think when they made those discoveries, and I don't want to say proof is in the pudding, but California legalized in '96, which is right around that time frame. So it's an interesting theory that people have is that, does somebody that has chronic pain produce less endocannabinoids than somebody who doesn't? So what we were saying is that you have this endocannabinoid system, you have endocannabinoids that work with this system. So does somebody with Crohn's disease, does somebody with chronic pain produce less? And if they do produce less, does it make sense to supplement that externally with THC? Right? So if somebody has a vitamin D deficiency, what do they do a lot of the times? They take vitamin D, right? So that's the same sort of thing with cannabis, right? So if somebody has this endocannabinoid deficiency, is it appropriate for them? And this is just a theory that's out there. But at the same time, that's, a little bit of the science and the medical behind, how cannabis works. All right, so we talked about THC and CBD, and the one thing about the products that you're going to see at our dispensary here in Verilife is ratios or combinations of these two cannabinoids. Right, so there's over 100 different cannabinoids in the plant. But the main ones that we deal with and we talk about at least today are the THC and the CBD. So just to go over the concept of ratios. So if I have 5 milligrams of THC and I have 5 milligrams of CBD, what is that ratio? 1 to 1, right? So if I have 10 milligrams of THC and 5 milligrams of CBD, what is that ratio? A little math to that one, but yeah. 2 to 1, 2 to 1. So really, there is a whole spectrum of products that we could work together as registered organizations out here to provide patients so that during that titration phase, when they're figuring out what's the appropriate ratio, what's the appropriate amount of THC and CBD that we could offer for them, right? And the sky is the limit. You could have a 1-to-1 ratio, you could have a 2-to-1, you could have a 3-to-1, you could flip it the other way and have a 1-to-3, 4-to-1 THC dominant over CBD. So really, depending on the conditions that somebody's working with and depending on their goals, that's what's going to be important when we in the dispensaries with the pharmacist and the patient care rep, we start making these recommendations for people. So with THC, and obviously there's medical benefits to it, but one thing that we have is impairment, right? So the high, right? Oh, the high that we get with it. Now what I like to do is to re-educate on the medical side of things that I don't like calling it getting high, I like calling it the negative side effect of impairment. Right? So I'll say that one more time. I don't like calling it getting high. I like calling it the negative side effect of impairment. Because one thing that's important, and I remember as a medical patient, as a Crohn's patient, that I still had to function. I still had responsibilities. Even though medically I benefited from THC and the properties that it gave me, I couldn't afford to have the negative side effect of impairment or be high. Right? So THC can have that side effect of impairment, but CBD does not, right? And if you look at CBD actually works, not to get technical, an antagonist at that endocannabinoid receptor that we worked at to actually help diminish that negative side effect of impairment that sometimes you could get from the THC. So really, when we're working with patients, that's the question, what's your goals and then what's your lifestyle? Because if you say, hey, I'm at a place in my life where I have a lot of symptoms and there's not a lot of things that are going on, then yeah, that might be a little bit more THC higher regimen to benefit them. But what we could do is we can modulate that CBD to help diminish that negative side effect of impairment. If somebody's goal in their lifestyle is, I want to get medical benefit from using cannabis, but I cannot afford to have that negative side effect of impairment. So that's where, like we said, working with the patient care rep, working with the pharmacist, having different options for patients out there with these products. The sky's the limit is how you combine these two different cannabinoids for the most medicinal benefit that they offer. All right, so the strains. So has anybody heard these terms before? Sativa, indica, hybrid? So that's really where everything starts, right? So when we make a product, the first thing that we do is we put a seed in the ground. And that seed is going to turn into either a sativa dominant plant or an indica dominant plant. So really, the difference between the two is the effects that you get. The sativas are a little bit more uplifting, they're a little bit more cerebral, where the indica, the effects that you get from that are a little bit more relaxating, a little bit more sedative. And then also hybrids. So basically through science and agriculture, they've been able to pinpoint different medical benefits from a sativa strain, combine that with different medicinal benefits from an indica strain to really put together plants that are geared towards treating different symptoms. Right? So a perfect example is indicas a lot of the times help more with pain relief. But indicas are a lot of the times more relaxative. Right? So what happens if I need pain relief during the day? Right? So we have the uplifting effects of the sativa, we have the pain relief for the indica, we crossbreed those two through agriculture, and we come up with a hybrid that has both properties. Now really, other than how these plants look, the indicas are a lot of the time shorter, bushier, sativas are a little bit more taller, longer leaves. The most important thing between the differences of the two are the terpenes. So I think some of these look familiar. Linalool is found in mint, alpha-pinene, and pine. So with cannabis, you have cannabinoids, THC, CBD, but then you also have terpenes, right? So the terpenes are going to be different whether that's a sativa plant or whether that's an indica plant, right? And the terpenes, in my opinion, are what really differentiate between, okay, we made this tincture or this solution that you drop under your tongue from a sativa plant. These are going to be predominantly, some of the things that you could expect from it, versus we made this tincture or this oil that you put under your tongue that's made from an indica plant. Because of the terpenes that come along with that, even in trace amounts through the extraction process, that's going to create a different experience for the end user, whether they actually get pain relief or whether they don't get pain relief. So, an analogy that I like to use is that with a car, right? So if I'm driving a 77 Buick, right? It's going to have gas. It's going to have brakes. If I'm driving a 2019 Cadillac, it's going to have gas. It's going to have brakes, right? So I like to think of THC as the gas, right? That's the go, go, go. That's, the heavy hitter. We have to keep in mind that there's that negative side effect of impairment sometimes, whereas the CBD is like the brake, right? That's like, oh, let's slow things down a little bit here. Now, the interesting thing, though, is the terpenes, right? Because even though that 77 Buick, I can press the gas and go, and I could press the brake and stop, is that driving experience going to be different than the 2019 Cadillac? Probably, right? It might be a nicer, smoother ride in the 2019 Cadillac, and that's where the terpenes come into play, right? So the cars both have gas, they both have brakes, but because of the experience with the terpenes, that's going to change how the effect is for people that administer the medication. And the entourage effect. So I had told a story a little earlier about a gentleman, stage 4 cancer patient that I worked with. And in my mind, that's one of the differences with what we provide with medical cannabis is the fact that we're taking this from the plant, right? We're extracting this from the whole plant. It's not the isolated THC, it's not the isolated CBD, it's not the isolated terpenes, but it's the conjunction of all these things working together, which is what we like to call the entourage effect, right? So, and I've seen it. I've been on the healthcare side, I've been on the medical cannabis side. There's a drastic difference between something that's isolated and synthetic versus something that comes from the natural plant. And in my mind, it's because of the terpenes, it's because of the cannabinoids, and the combination of these things working together to optimize the results that patients get when they take this as medication. All right, so the types of products that you could expect at Verilife and Staunton when we open up. So a couple different options here. So we have ingestion, oral, and topicals. So for example, with the oral, right? So basically whenever you ingest something, there's ways to absorb it, right? You could absorb things through your skin. You also have an absorption point under your tongue. You also have an absorption point in the back of your throat. So the good thing about the oral solutions that we have is that comes with an eyedropper. You would put that underneath your tongue. You would hold it for 30 to 40 seconds, and then that's where the absorption would start. So a lot of the times, that's going to be a little bit more fast acting, right? So there's certain patients that come in and say that when I'm in pain, I need relief pretty quickly. And that would be the product that we would recommend for them, an oral solution, because they can absorb it under their tongue and it's going to be a little bit more faster acting. Now on the other side, you have ingestion or capsules, right? So capsules are something that we take, we swallow. It goes through what's called first pass, or where in the gastrointestinal system it starts breaking down the medication. And what happens is when that goes through, it goes through the liver. The liver is going to change the THC to a little bit of a different molecule that's going to be released a little bit slower throughout the system. So the benefit of having something that you ingest would be, okay, it's not going to be as fast acting because it has to actually go through this process before absorption starts, but it's going to be a lot more long lasting, right, for longer effects. And everybody is different. I've worked with patients that, do combination therapies, where they might have an oral solution that they take PRN or as needed for breakthrough pain, and they might have a capsule or something that they ingest on a regular scheduled basis until they start minimizing their symptoms and getting relief and getting the results that they want from medical cannabis. The other thing is topicals. So topicals, they can be applied locally to different locations. A lot of the times those don't go systemically, and a lot of the times you don't get the negative side effect of impairment when you have the topicals. But these are, and like we had talked about earlier, even in these three different forms, so to say, imagine the possibilities based on the ratios of THC to CBD, right? So you can have a 1-to-1 in each of these three different forms. You could have a 2-to-1 in each of these three different forms. You could have a 3-to-1 in each of these different forms. And that's what's going to be, talked about with our patient care reps and our pharmacists, depending on how you're dealing with the medication, how you're feeling once you start your regimen. It's not uncommon to, develop an awareness with your body and how you're reacting to cannabis and modulate this on a daily basis. So what I tell people is that initially when you're trying to find what I like to call your therapeutic threshold, or the least amount of cannabis that you need for the most therapeutic benefit, what you're going to do is, I mean, it's that titration phase where you're figuring out, okay, let me take a capsule. Let me wait an hour. Let me assess, okay, what's going on with my symptoms that I were trying to minimize? What's going on with my stress levels? What's going on with my breathing? At that point, do I decide, do I need to take another capsule? Or am I pretty good with the dose that I just ingested? So, you know, like I had referred to a little bit earlier, it's a 50-50 relationship with the patient. It's proactivity between the pharmacist, the patient care rep, and the patient to really figure out what's appropriate, and then also teaching the patient to pay attention and to be aware of their body so that big picture, they can make the determination, do I need a one-to-one right now? Do I need a high THC right now? Do I need a high CBD right now? And that's what's different from medical cannabis from, you know, at least my experience with the healthcare industry. And microdosing. So has anybody heard of this concept before, microdosing? So really, I mean, you know, and I've worked in dispensaries, I've talked to many of our pharmacists, I've talked to many of our patient care reps, and that's where we've seen a big benefit with people getting results and getting their symptoms alleviated is through microdosing or smaller amounts of cannabis throughout the course of the day. Right? So it's an amazing plant. You don't need very much. Right? And I think that, you know, working with people, teaching them the concept of microdosing, teaching them the difference between THC and CBD in these ratios are going to be the most important thing with the education that we offer, not just in the dispensaries, but out in the communities. All right, so before we get to the questions, just to summarize all that, we are ecstatic to be providing medication to patients of Staunton. We've been waiting for this opportunity.